Of course, one of the most important aspects of diving is diver safety. And here in Barbados, just outside of Bridgetown, I've come to meet Dr. Michael Brown, who runs the decompression chamber here. Hello, Dr. Brown.
Well, thank you for coming and letting us show off us our piece of kit.
Thanks for talking to us. Where exactly are we, actually?
The chamber has been based at the headquarters of the Barbados Defence Force, which is in St Anne's Fort, the old colonial garrison that was abandoned in the late 19th century. It was based here because Barbados Defence Force has a very potent Coast Guard unit with active divers, and fortunately we don't have to treat them very often, but it will be irresponsible for us not to have a treatment unit for the divers of the Coast Guard, and incidentally the divers that come to visit here and enjoy all our dive sites.
Right. So we're actually on a military base, and you are a military doctor as well as a general practitioner.
My first love is family practice. I got into hyperbaric medicine because divers came to see me before we had a compression chamber here. And fortunately they knew something about hyperbaric medicine and were able to tell me what to do. I didn't think that was sufficient information, so my interest in hyperbarics increased, and I, with the help of the Defence Force, was sent abroad to train in hyperbaric medicine, and eventually, because of the Coast Guard, we acquired a chamber in 1984.
So this is one of only a few chambers in the Caribbean?
We're about the only chamber that will guarantee 24-hour service 7 days a week. There are other chambers in Martinique and Guadeloupe, in Tobago and Saba, but they're not as militarily operated as our unit.
And this isn't the original chamber that you had, is it? This has been changed, upgraded?
No. The original chamber came from the Royal Navy, a refurbished chamber from a frigate, and served us well for 20 years. And so 4 years ago, we acquired a new chamber, which is somewhat bigger and more luxurious than the last unit, but still a very basic twin-lock chamber.
How many patients can you cater for at any one time?
If we've got a paralysed patient who has to be on a stretcher, then really only one. However, we do a lot of other treatments for non-diving incidents, hospital patients with ulcers or burns or crush injuries, and we can get up to 5 patients sitting relatively comfortably inside the chamber with a medical attendant. All the patients are always accompanied by a qualified hyperbaric medical attendant.
Right. Well, I never thought I'd say this, but can we actually go and look inside? Can we go inside one?
By all means.
Okay.
It's not as scary as it looks.
So we're now actually inside the pot.
Yes.
Why would we be in here?
Well, in my experience, divers are really the only people that don't get bent. They have an enormous reluctance to admit that they've spent too much time at a depth sufficient to increase the nitrogen concentration in their bodies to a point where they get decompression sickness. The symptoms to start with can be extremely minor, from a tingling in the skin, an itching in the skin, which may or may not develop into pain in muscles or joints. And once pain starts, then anxiety sets in as a rule, and they do have the good sense to phone the compression chamber, and we're available 24/7. There's always a doctor and a team available to start a treatment. They would be referred by a dive unit, perhaps, here in Barbados. They may be coming from another island, in which case we'd have to arrange a special low fixed wing flight at 300 meters over the water. The other islands are 100, 150 miles away from here, so that may take 2 or 3 hours, in which time they'd be on just plain normobaric oxygen. And then they'd be brought to St Anne's Fort by ambulance. And they'd be transferred to our assessment room on a stretcher, and if they were sufficiently weak that they required stretcher treatment, then this new chamber is able to rail them into the chamber and they can be treated horizontal, or otherwise they'd be sitting on cushions similar to the ones that we're on now, but not facing each other. They'd be down the side of the chamber, and we'd start a treatment regime depending on their symptoms.
I understand that over the years this has been refined, adapted, modified. I guess a lot of it has been trial and error in the early days, from experimentation on some animals.
Indeed, if we go back to the origin of diving, underwater diving, then Professor Haldane in the early 20th century was given a brief. He was a physiologist that worked at Alverstoke in the south of England, and was given a compression chamber in the early 1900s and a herd of goats. And so the tables that we use today are fundamentally based on Professor Haldane's herd of goats that he did experiments on for several years, establishing a routine of diving that would allow Royal Navy divers to be relatively safe from decompression sickness. His original brief was that no more than 4% of the divers were allowed to get bent. That is not acceptable these days, and the algorithms in computers are such that it is much safer if you follow your computer.
You dive yourself as well, don't you?
I do indeed dive myself, not as much as I would like to, but yes, initially when we first started lobbying to get a chamber in Barbados, I was told by a lovely lady, Martha Watkins, that I was not allowed to be a diving doctor unless I'd learned how to dive. And so reluctantly I learned how to dive. I've enjoyed it ever since.
Scuba diving isn't just all about dropping into the water, going down and seeing all the pretty fishes, the wrecks, etc. There is some physics involved. Perhaps you can explain the problems and try and explain that to us.
One's given the impression that you can just put a regulator in your mouth and jump into the water. And fortunately, the dive operations in Barbados are very careful and frequently ask one of the diving doctors whether this particular individual with their medical history is going to be safe diving. And I always warn people that come for a diving medical before they qualify that diving is one of those edge sports, like mountaineering or motor racing or parachuting. It's something to be taken very seriously, and the instruction is very important, because when we're breathing normal air, then 20% of what we breathe is oxygen, but 80% of it is nitrogen. When we go to 10 meters underwater, there are twice the number of molecules. And depending on the amount of time we spend under pressure, the amount of nitrogen in our body increases as a proportion to the depth and the time. The consequence of that, after all, we haven't got gills, but we are made of water, and like our distant cousins, we did come out of the water originally, and we have lost the ability to exchange gas easily, so that the extra nitrogen in our body, we actually become like a soda bottle. I happen to have here a recognized commodity, and if one spends, let's say, an hour at 40 feet, you're getting close to the time when you have to consider decompression. If you spend an hour at 90 feet, then you really become very much like this soda bottle, except more like this soda bottle. Now, would you be happy opening that in this confined space?
Not really.
No.
I don't want the cleaning bill.
Well, exactly. So the gas that we've absorbed comes out as bubbles. Now, we can open this bottle quite safely, simply by letting out the pressure slowly. If I had pulled this bottle open quickly, we'd have had Coca-Cola all over the inside of the chamber, and my team would not be very pleased with me. But if you let the gas out slowly, then it doesn't bubble, it doesn't become explosive, and nitrogen comes out as bubbles if you decompress too quickly after a deep dive. And a deep dive may be as low as 10 meters, although the length of time you'd have to be at 10 meters is something like 8 or 10 hours. But if you go down to 90 feet, the length of time you can spend without decompressing there is less than half an hour. So you've got to remember that there are consequences from enjoying the pleasures of self-contained underwater breathing apparatus. And these bubbles can come out in the skin, hence the itching, can come out in the muscles, muscle pains, joints, aches in the joints. And those are the minor symptoms. They are an indication that you've got too much nitrogen on board, and you don't want to wait until you notice a terrible weakness in your limbs, or you're not able to move your legs anymore. That's an indication that the bubbles have actually come out in the wiring in the body, in the neurology of the body, more usually in the center third of the spine, causing problems with bladder and abdomen and the movement of the legs. So scuba diving, while very enjoyable, is something to be taken seriously and qualified in properly. And even in those circumstances, just like parachuting or driving a racing car, things may go wrong, and we have this to put things right.
Commercial diving, which is obviously a completely different thing, they go for long distances underwater and spend 30 days or so to negate the problems of this nitrogen build-up, don't they? They slowly come up from their depth, and
the commercial diver has to go to depths in excess of 90 meters. And that means that they can no longer breathe air. Air becomes poisonous to them. So they are what's called mixed gas divers. They would have, peculiarly, only a very little bit of oxygen in their breathing mixture, a fair amount of helium in their breathing mixture, and if they're going very deep, then you would actually start adding back some nitrogen as well. But these people are saturation divers. They take time to become saturated, and then they can do their work, and they live in chambers not dissimilar to this, sometimes, well, always a little bit bigger, where their food is put inside to them, they have TV, they have bunks to sleep in, and they may be under saturation pressure for as much as 2 weeks. Having done their stint at their saturation depth, then they would be decompressed very slowly on changing gases, and it may take as much as 3 days to get them out of their saturation. So completely different to scuba diving. There is some mixed gas diving done by recreational divers, and yes, it is available in Barbados, but it's not something that is frequently used. Open water diving is just on ordinary compressed air.
so if you are unlucky enough to have become like a Coke bottle, we're in here, the door's closed, what happens next?
The atmosphere in the chamber itself remains air. The medical attendant with the diver will be put under pressure, and these days we go to 3 atmospheres absolute, what in old terms would be 66 feet of seawater. This is a treatment regime that has developed over the 24 years that I've been involved with hyperbaric medicine, from a variety of different tables to really using the maximum pressure at which oxygen can be breathed 100%. If you take oxygen at a greater pressure than 3 atmospheres, then it too becomes dangerous. Under pressure, the medical attendant will guide the patient who is put into an environment which may be a mask over his face or her face, or a hood with a seal around the neck. And we then control the air that they're breathing, which would be 100% oxygen for a period of 20 minutes, and then a 5-minute air break. The 5-minute air break being essential to make sure that we don't get the complications of excess oxygen. And that regime will depend entirely on the symptoms of the patient that comes. A superficial ache or pain, a niggle as it's sometimes called, may only require a treatment of 2 or 3 hours. A more serious paralysis may start with a treatment of 10 or 12 hours and then take a break, and then after that have intermittent treatments of usually 2 hours. Hopefully only once a day, but if the situation is serious we may do it as much as 2 or 3 times a day.
So I think a lot of people are surprised at what you've just said there, because I know for a fact a lot of people are under the impression that once you're in the pot you're there forever. Is that the old methods?
Well, and yes, it was not unusual to have a 2 or 3 day treatment when we were just using air tables. It had been recognized that oxygen was dangerous, but the limits at which you could use oxygen at 100% had not been clearly defined. Since that definition, we're now able to treat people intermittently and, in fact, soak them in oxygen to a point where they no longer need the chemical transport in their blood. That's the hemoglobin. Professor Haldane proved that you can exsanguinate a goat and put them at 3 atmospheres breathing pure oxygen and they will be perfectly happy. Unless you don't put the blood back in when you decompress them, they're not happy. But these days we can treat a sickle cell crisis where the patient may have lost 90% of their chemical capacity to carry blood, and yet we can put them in here on oxygen, keep them going until the blood transfusion is prepared, give the blood transfusion under pressure, and they can walk home for tea.
Hyperbaric chamber isn't just for bringing divers up then, it does have other medical uses?
By no means, by no means. There are diseases laid down by various authorities that define the diseases in which hyperbaric medicine can be an adjunctive therapy. It's not a cure-all by any means, there are always other things that are done, but if somebody has a bad limb crush injury, the blood supply may be compromised. We can oxygenate the limb until the surgeon's handiwork is allowing a normal blood supply. Burns. People die from burns because of the enormous amount of fluid that is exuded from the skin that has been burned, and hyperbaric oxygen can reduce that fluid loss by as much as 60%. More commonly, diabetes and deteriorating peripheral blood supply can produce ulcers in usually the lower third of the legs, and these ulcers can be healed more quickly using hyperbaric oxygen because they are fundamentally due to a lack of healing blood supply, and the oxygen provides that little bit extra nudge to close up the ulcers.
So we've actually seen these scenarios of actually needing the chamber. We're now going to get Dr. Brown to explain to us exactly what all these controls do.
All of our operators and inside tenders are Defence Force personnel, either from the Coast Guard or from the medical unit. We have a small hospital just outside this unit. And before you would be allowed to run this machine, you would have to be a qualified nurse and have hyperbaric training. All the inside tenders are medically trained hyperbarically in the Coast Guard, and then you can graduate up to operation after that. And the operation is, I'll just run through it quickly with you and see if you can catch on. This is where the air is controlled to put the chamber under pressure. These are the 2 exhaust valves to make sure that we can maintain pressure, flush, and exhaust, bringing the pressure down to normal. The depth gauge is here. There are 2 gauges delivering the oxygen and the compressed air from the compressors that are outside. Depending on how many patients are actually inside, there are 5 optics here that would control the breathing gas going to the 5 inmates. We can switch them from air onto oxygen automatically without them being aware of anything. To monitor the atmosphere inside, we have an oxygen monitor and backup gauges down here. We haven't spoken about the airlock. There is a medical lock to put in drugs and medicines and things. Obviously, if you're in there for 6 or 10 hours, there may be some personal operations that one wants to fulfill, and getting a urine specimen in and out is fine. Anything more serious than that would have to come out through the medical lock, through which we can actually move personnel in and out and change tenders. The doctor can go in and examine the patient, and there is a similar control panel here with optics and pressure in and out.
I'd like to thank Dr. Brown for his time in showing us the hyperbaric chamber and explaining the background to the physics of diving and the bends, something which obviously as divers we all hope we never experience. Why is it so important that Barbados has its own chamber here? And what are the benefits?
Well, there is only one way to treat a diving accident. Once you have either a nitrogen bubble or an air bubble in your system, you have to go under pressure. Incidentally, we do open heart surgery here, and air embolism is a very rare but real complication of open heart surgery, and the only place to treat them is in a hyperbaric chamber. With my early experience of diving accidents, it became obvious that a country that was promoting itself as a diving destination ought to have the wherewithal to treat a diver when they become poorly. And the chamber actually came to the Defence Force because the Defence Force was acutely aware of the risks of their Coast Guard, and they were the ones that pressured to acquire the chamber in the first place. It is run by the Defence Force, it is sponsored by the Defence Force. The personnel that operate our Defence Force personnel, the inside tenders, are qualified nurses and hyperbaric trained. And there are 4 doctors, all of whom are associated with the Defence Force, who provide services 24 hours a day. When somebody gets into trouble, if they're out of hours, then 436-5483 is our local telephone number. It's separate from the hospital, because if compressed air is involved, the hospital are perfectly capable of stabilizing a patient, but we're on duty so that we can get the patient directly.
But the most important thing is, if you're in any doubt whatsoever, ring that number.
436-5483, and they will put, it's a dedicated line in the medical reception centre, and they will get in touch with either Dr. Roach or myself, and we will be available.
And no one's going to worry if it's a false alarm?
Oh, quite the reverse. We would much rather send you home reassured than have you come 4 hours later worse than you were to start with.
So divers, don't be in denial about bends.
Thank you very much.
No, thank you. Thank you very much indeed, Dr. Brown.
Pleasure.